Hey guys, welcome back to the Sleep Well Journey podcast. I'm so excited for today's guest. I am Dr. Callie Hale.
And I'm Dr. Kyle Hale.
And we have today with us a personal friend and mentor and trainer, Dr. Zach McVey. Welcome.
Thank you.
We're so excited to have you. He is here in League City, Texas with McVey Chiropractic, also the Warehouse Gym. And we finally got him to come on and talk about how special he is and how we work together and treat so many patients with airway and breathing disorders, as well as TMJ pain. And we have a jam-packed 50 minutes with you guys today. So thank you so much for coming on.
Absolutely. Thanks for having me.
So I'm going to start this just because I think our story is kind of unique. And I don't know if I've ever shared it before with you, but years ago, we used to live in the same neighborhood, right? And I was worried about this guy over here. And I was like, you should work out. We got to get a trainer. You're stressed.
This is a good story.
This is a literally true
with
story.
Him meeting me thinking I was an overweight dentist.
Yes.
Are you kidding me?
No,
Wait, I've never heard this
part. I'll give you
part
my
of it.
side of the story
Yeah.
too.
Okay, I can't wait. Okay. So his lovely wife, Sharon, had messaged me. I think maybe I messaged her first on Facebook, and we were kind of going back and forth. I was asking about pricing and like what it would look like. And Kyle and I are so incredibly busy, but we were very busy then too. And I just didn't know how we were going to be able to fit it into our world. I mean, we worked 8 to 5s and we were super, super busy.
We were really busy in the business and we were busy in the clinic. And
right.
We had
a baby. Yeah. And so, I talked to her for a little bit and then I don't know, I disappeared and maybe I just blocked her on social media for a while. I don't know what happened.
It was called Harvey.
It was,
Yes.
Harvey happened. Okay. Hurricane Harvey, if you guys are not listening from Texas. So Hurricane Harvey hit and then, time got away from us and time went on, but somewhere in there, she messaged me again. I'm pretty sure that's how the story goes. And I was like, yes, this sounds fantastic. And now I need information on what it was like on your end, because I never knew you thought he was like this overweight dentist.
Yeah. So I remember that you guys wanted to try to get in with me. And my schedule was full. It was during the summer, and I had started my summer classes for the youth classes, and I just didn't have time in my schedule. So we were like, we just got to put this off, and it was what it was. And then Hurricane Harvey came along, and we had damage to our office and just kind of things that got out of place and just forgot, honestly.
Right.
But then you called back, or she called back, however that came about. And I just remember her telling me a little bit of information about him, had high blood pressure, and so my whole picture is just this,
had high blood pressure concerns.
High blood pressure concerns, yes. And I just remember envisioning this super overweight guy with like
it's like fat
head
dentist.
is like purple because his blood pressure's so high, and sweating out Alfredo cheese, just. I had this terrible vision of him. Yeah.
I was going to pull in a 10-year-old Cadillac and roll out of
it's just
the
like
side door.
Oh my God,
wearing his 1970s coaching shorts and, But anyway, then he comes into the office and I'm like, oh, well, this isn't anything that I was expecting. This is something I can work with.
Oh my God. I was like, oh, good.
Like, man, the level of effort went way down after that.
Awesome. Yeah. That's so funny. I never realized how I must have portrayed you in messages to Sharon. But yeah, I mean, we've talked about blood pressure actually a lot on the podcast. We talked about blood pressure with the cardiologist we had on, even with the previous nutritionists that we've had on. And so obviously that's been a concern of mine for you for a long time.
Would you fix your microphone, please? It's bothering all of us.
I don't know how to tighten it.
So one thing that I think is unique about you is that you've got more credentials than just the chiropractic, and more than this the strength training. Callie has had a personal trainer in the past. I've had many different coaches across different types of hockey and other sports, and so something that is really unique is in our workouts. I'm not injury ridden, but it seems like it seems like I think I'm due. All right.
Oh, stop! Don't even joke. Don't even joke.
Something would happen, whether it was back pain from being at work, because that's really why I started with you, because the back pain was getting unreal.
Mm-hmm.
And the more I worked out, the better the back pain got, which seems counterintuitive because by then I was really just treating it with getting a massage all the time.
Yeah.
And getting all that stuff released. But working out with you, if it's something bothers me or hurts, you just on the fly change up the workup, and we do something a little bit different. same kind of movement, just in a different direction or different weight or different body position, and all these things change, and I'm still getting a really good workout, and I'm not under any kind of like distress. Or
he's
pain.
definitely not going to let you use it as an excuse not to work out.
Yeah.
Well, his favorite workout is called 2 minutes of work, 2 minutes of rest, where you do 2 minutes of work and then you do 2 more minutes of work and then you go back.
And then you try to
do that. It's like, and he really called it 2 minutes of work, 2 minutes of rest one time. I was like, it was like a row as hard as you can for 2 minutes and do a plank for a minute and then get back on the rower.
Yeah.
So. Well, no, your workouts are incredibly unique, and Zach and I share a lot of patients in the airway space for TMJ pain. I mean, if you guys are in the League City, Houston area, he is my go-to referral for acute and chronic TMD patients. And while I might be doing oral appliance therapy or some sort of stabilization, at the same time, I like an intraoral manipulation, and he has helped so many people. But as Kyle said, yeah, I've had a lot of trainers. I had a trainer in dental school personal trainer in dental school that I really liked. It cost me like nothing. It was at the local dental school gym. And then I actually tried somebody. I don't know if you remember, there was a gym at the beginning of Westover Park is. Mm-hmm. And I don't even remember what it was called.
Well, there's been a couple different ones up there, but
but his is the best. But yeah, there was a gym there, and I went, and they also did like some bar classes or Pilates. I mean, it was like 9 years ago probably, because I had just had my son, and I tried this guy, and it was just not good. There was no unique tailoring to it. Was just you just kind of did it. And I was like, I'm a lot stronger than what he realized, and it was not very good. And then it just wasn't. But you started with, whatever. We'll get to the pull-ups in a second, okay? But you started first, not me.
Well, I was going to say, like, I started saying that because I wanted to know more about your journey to getting to where you are, because it's not very traditional that you have a chiropractic office attached to a gym, and that you do both. You have patients that are on the table. You have patients that are in a squat rack too.
Yep.
So how'd you get there?
So in college, I studied athletic training. And my primary aim at that time was I wanted to become an orthopedist. And then when I graduated from college, I did my primary focus of my degree was microbiology. And so I had a lot of interest in, at the time, things like Ebola and things like that. And I got an opportunity to be part of a team down at UTMB doing HIV research, and I did that for about 3 years. And at that point was when I kind of decided maybe medicine wasn't the route I wanted to go through. And unfortunately, I was doing clinical trials on people with HIV, which a lot of those people didn't survive. And so I was kind of like, I just don't know that this is what I want, know? Right. So at that time, just by act of God, fate, however you want to look at it, I found out about chiropractic, and I really didn't know anything about it. So I went and checked out the school, and I was like, well, this is kind of more my mindset anyway. It's more prevention, not fix it once it's broke. Let's try to find things to prevent injury. And so I went through chiropractic school. While I was in chiropractic school, I worked as a personal trainer at one of the larger commercial gyms. And from there, once I graduated from chiropractic school, I practiced just solely chiropractic for a couple of years, and then after Hurricane Ike, I kind of had a change of course with some things, and decided, I want to open a gym. And this was pre-CrossFit wave. Okay, so it was at the time. People were like, you're going to open a what? Like a warehouse gym. What is this kind of thing? Awesome. Now it's common,
Yeah.
But so I wanted to double dip. I enjoyed training people when I was in chiropractic school. It was fun, and it was an application of things that you learn. And so that's when I started, okay, I'm going to have a clinic, and I'm going to have a gym right beside it. And oddly enough, they're two separate crowds, honestly. I have my patients and a few that cross over to the gym, and then I have my clientele that I train, and some of them are patients, but there's just not, it's like one, and they're the same. I have two different groups that I really work with. And so that alleviates a lot of boredom professionally. I do have the opportunity to jump back and forth, and the clientele that I train. I don't have a personal training certification. I'm a certified strength and conditioning specialist, and
awesome.
So that's my credentialing on that. So that's a little bit higher standard as far as the profession. And then I also have my diplomate with the American Board of Clinical Nutritionists. So
amazing.
That's a step up. That's postgraduate work after chiropractic school that I went through, and so I have the nutritional side of it, which is a little bit different take than your previous guest, where she was a nutritionist working solely with dietary type things. We do that as well, but then we also look at the supplementation aspect of it as how can you optimize that as well.
Yeah, that's so cool. I remember meeting you when, I don't know, I came in to do that first assessment. I really wanted to show you how strong I was, But over the years, I have really enjoyed our conversations, and I have found it so interesting how much you know about everything. Like, I know a ton about dentistry, and we've had, I think, really fun dental conversations and just linking up like how all that is. But it is incredible to me. If I have a question about something random in nutrition or physiology, I'm going to ask Zach about that tomorrow, and he's gonna be able to tell me that. And it is so impressive, you guys, truly. And you can feel that. And I just get nothing but accolades from my patients that I send to you too about how they feel. And I just think it's so unique how unique our workouts are every single time. Like figuring out what we did before and what that means I should be able to do again. I'm like, I don't know. I just show up and lift whatever he says to lift. I don't know how any of this works, So it's really outstanding.
Then from my side, there is a very detailed plan of where we're trying to go. I actually have for you drawn out till like June, July already.
Oh my gosh, so, that's awesome.
Yeah, there's
a lot of pull-ups in there, I'm sure.
Well, of course. When I sit down and draw up a plan for somebody, everyone's individual. I don't even know what my youngest client is. I have some high schoolers in my high school class that I train. They're freshmen all the way up to...
That's so important.
My oldest one is 87. He competed up until 85.
Guys, no excuses.
His deadlift record is he did 308 in competition at 85 years old. So that's one of my long-term goals, is to be able to give that one a go for myself, So, he's been an inspiration to me, just to say, hey, look, this is what longevity looks like right here. Sure. Everybody's individual, depending on what their goal is. And so when I sit down and write out a plan, I try to say, okay, what is it they want to accomplish, and how do I get them there? And with you, we've got your 1,000-pound club that we want to get to, correct? Right. Yeah. Which I don't want to add a little jab here, but did you see Hawthorne this week with his at the Arnold?
I did not see Hawthorne.
Hathor.
Oh, Hathor.
The mountain.
1,020.
1,006.
1,006, yeah.
Oh my gosh.
That's crazy. And he did it.
So we want your goal to be 1,007 now.
You know Kyle very well.
Yeah, he did it in one.
Yes, one deadlift. That's it.
No, that was impressive. And but when he went up with it, it looked like the ground was trying to get rid of it. Like he was like, "No, this is mine. I'm gonna go."
Yeah, he didn't look like he was trying really. A little bit of effort, but not much.
This is my luggage. Let me move it for you.
Yeah. Wow. So I know and I'm so impressed with like your goals for yourself with that. And honestly, my only goal really in the beginning was I wanted to be able to do a pull up. It really, I think I said 3. I was like, if I can jump up and do 3, then I'm a fitter mom than I'm as fit a mom as I want to be. Yeah. And so we beat
and
that.
not just a mom, but women in general. Yeah. Okay, so you're one of them where I've a pull up was your goal. We've gotten you there too, but secretly one of my goals for you is to get you to 2 plates on deadlift, which you're almost there.
I
and
never
so I've always throughout my years of working with clients and patients is any females who can deadlift 2 plates, 225. I find that quite impressive. I mean,
sweet.
That
I got that goal now, guys.
For long-term health, bone health.
Right.
Okay, so structurally you can handle that. Your muscles, tendons, and bones can handle that, and that's something that is going to carry over long-term into your 50s and 60s as far as your risk for osteopenia and osteoporosis.
Sure.
I mean, so again, I'm not looking at each one of my individual clients as, okay, we're just lifting weights. Sure. What is the long-term impact? and what are we trying to accomplish here?
Absolutely.
With you, when we first started, it took me a little bit on exercises that were back healthy exercises would light you up, right? And so one of the things I learned through you and your father-in-law and you as well is you all have dentist posture, okay? So there's certain movements that are actually going to aggravate because you're in that posture all the time anyway. So I have to figure out how to come backwards from that, and how's that going to stabilize your back, your hips, your neck in the long term, right?
Is dentist posture is that
it's a scientific term. Yeah.
Is that a thing?
Yeah, it's in our chiropractic books. You don't have it in your dental books, but we have it in our chiropractic books.
we just call it posture. That's why.
Bad posture, right?
Wow.
That's my favorite thing to do is to sneak around the office and see the other dentists and hygienists, and I snap pictures of them when they're craned over.
Oh,
like
we will
this,
be
Yes.
so
like
bad.
Well, and also I think like there's been times where I've been like in a long procedure, usually like a surgery, and my reflection hand, my left hand, I'll be elbow up with the tense shoulder for like an hour straight and not realize it. So I put it down like, oh wow, that was that was a lot. And that's pulling a cheek or holding a jaw or holding something.
Yes.
But really, as long as I was staying on top of my workouts, my back pain was gone. I'd have these couple of flare ups every now and then, but that was it. And then now that I practice a lot less now, but not because of injury, because choice.
Yeah, but I'm also careful not to put those exercises back in
Sure.
because I know they're again,
like we don't
quote
run.
back healthy exercises were not healthy for you. They were actually worse for you. So I took those things out.
And you found that article in Indonesia today where it said running was bad for your back.
Oh, yeah. So Kyle over here really does not enjoy cardio. And I always joke with Zach, would you just make the guy run?
I don't like running. There's a
Okay.
difference.
Sorry.
I love to row. I think it's nice.
Me too.
Well, I took running out of his workout when you guys brought Benton with you that one time, and Benton beat him down and back. And so I was like, man, it's like,
That's our 9-year-old son.
yeah, that's that can't be
seven,
good
yeah.
for Dad's ego there. I know there's letting your kids win, but you got smoked. I mean, it wasn't even.
God,
It was bad.
Yeah, I've always been able to outrun you, but
Yeah,
you have bigger legs than
That's
me.
by
So.
choice. That's by choice.
he burns up the rower now. We get it.
Yeah.
We get it.
So kind of in a little tangent, I know early on I did my postdoc stuff in sleep apnea back in 2019. So it was prior to me seeing you, because then Harvey was in 2017.
Yeah.
So I think you had started seeing Kyle, but I'm curious what that was kind of like on your end with how much sleep apnea knowledge. I mean, I just word vomit all the time when I'm at the gym now. I'm like, oh, I got this and this. And then we got did you have, and how has that kind of changed, if it has?
Oh, it's
your
grown
conversations with your patients
quite a bit. So I wouldn't say I was an expert by any means. Knowledge of sleep apnea, okay, my extent was pretty much okay. Yeah, do your upper cervical adjustments, things like that. But a CPAP is kind of the standard of care for it. And then once I met you guys and really started learning about some of the technology that's out there that you guys are working with, then I took that on myself to pursue that. And you said earlier about, I know so many things about so many things. I don't really. There's not
Yes,
an
you do.
original thought in my head. Everything I say is regurgitated from something I read from somebody else, right? But that's it. I constantly try to learn. If I don't know
Right.
something, I want to know, okay, why and what about it, and try to see, okay, how does that apply to either my patients or my clients? How can I make their lives better? And so once I was introduced to you guys and the various technologies that you use, I just started pursuing things like that and going down some rabbit holes on some stuff and really learning and it, not only patients that you refer to me, but my patients that come in as standalones. Okay. I refer to you when I see those cases that are like, okay, yeah, this is more than just your neck or your pillow or your bed or your chair or your desk or whatever those situations are. We try to say, okay, what can I do to help you that I don't have the tools to do?
Sure.
And so I would say meeting you guys has added a whole nother dimension in knowledge that I probably wouldn't have pursued. And so,
Sure. That's
You're
awesome. Yeah.
It's like
You're
Maui.
welcome.
You're welcome.
You're welcome. Yeah. Well, I'm loud about it all the time, and I love to vent. Actually, our workout sessions are more like therapy sessions, I think, most of the time anyway. But yeah. Well, so even for us in dentistry, I mean, we had little to no chiropractic information
definitely
in dental
no.
school.
Yeah.
Zero.
Sub no.
Yeah, and really not a whole lot on temporomandibular dysfunction either. I mean, we just knew that there were specialists that you would like refer to, but we weren't, trained in it. And I got a lot of that in my sleep residency, but there's just some things that I cannot do, nor do I have time for, and I know you're way better at it. So that's where, if you are listening to this and you're local and you're having clenching and grinding pain, we've talked about that a lot on the podcast, that's sleep linked now to sleep disorder breathing, potentially sleep apnea. And if your disc is slipping and you're having that muscle tension, then having somebody who's really trained in intraoral manipulation is very important. So yeah, I'm that's a big deal.
So what's something that's, a few weeks ago you're talking to me about a study you were reading about where, was it the grip dynamometer and testing something?
Yeah.
What's something that, something recent, maybe that one or another one that you've read about that's kind of been on your mind lately?
Put you on the hot seat.
Yeah.
I actually think we should talk about the grip thing, because I was like, what is this? And then, anyways.
I just read constantly, so I think there's so many things out there that are fascinating. Well, I told you about the one that I saw today about the psychology of reinforcing your kids positive or negatively.
Yeah, that was really important.
So that one was kind of a big eye opener as far as parenting. I have 5 kids and they're all pretty much grown, and most of that stuff was kind of my mindset of parenting anyway. It's, if you can't do it, well, why can't you do it? And try to figure out why or how to do it. And, at this point, all 5 of my children, I think, are seemingly healthy and
they are
good,
wonderful people,
goal-driven kids, and working out there to accomplish what they want to.
It's really weird. They're all fit.
They're all fit, which is also another thing. I don't live vicariously through my children. So it wasn't like you have to go to the gym or you have to play sports. If you want to, I will support you in it, right? And for the most part, all of them, except my youngest son, like to exercise. He just doesn't. But that is what it is with him. I know it's funny. I don't get down on him about it.
Right,
he ribs back at me about it, whatever. But they all just naturally have that desire to want to go to the gym and exercise and eat right, and so they just do.
That's wonderful.
I'm grateful that they followed without me really having to push them. That they I guess saw me as an example.
Definitely. No, we've met all of them, and your kids are a testament to you and Sharon for sure. I mean, the fact that they want to exercise and do all that, I think, is amazing. For me, on the dental side, I'm like, my kids can never have a cavity. Well, that's at the door, because they definitely got one. But they will have, I can guarantee you, the largest jaws absolutely possible. So our 7-year-old's in an expander. My now 9-year-old has been faithful to his tooth pillow since he was 5 or 4, and he's going to be every bit as big as you've seen him, Kyle.
Sure. Yeah.
The kid is thick.
Yeah. He's a big kid.
Tall and Benton.
Yeah, he's like every bit of me.
Well, you're 6'4", so he's going to be every bit of. Well, you're thick too, babe. I don't know.
I'm 6'4",
in a good way. In a good way.
In a good way, right? Yeah. We're trying to make you bigger, right?
Yeah. So, and I think just in the journey of jaw development, pediatric stuff, your kids were kind of too old for the tooth pillow stuff by the time we met.
Right.
And I think that was kind of a side into the lack of knowledge there is in that pediatric growth and development, as far as straight teeth not just being straight teeth. Right. And I don't know how much in pedo chiropractic therapy, if that's ever discussed, as far as mandibular advancement and getting them out of that, micrognathia.
Not really at all. I mean, we're aware of it.
Sure.
We do have a pediatric, we did when I was in school, had a pediatric course. And, you talk about those things, but no real, okay, what do you do about it? What are your solutions? Who are the other professionals you send to?
Right.
Really that's where I think all of us in our healthcare professions lack, is the ability and the desire to be able to refer back and forth. I'm a chiropractor, and so the general idea is that chiropractors only believe in natural health and are anti-medicine and this, that, and the other. And I'm not. Okay. I tell people, if I'm having a heart attack, don't call my chiropractic buddy. If I break my arm, take me to the ER. Let's reset it. I'm not going to take an adjustment.
Absolutely.
They're common sense things, right? And so medicine has its point and its purposes, and I feel like from my profession, medicine is supportive of what we do,
Sure.
whereas from the medical standpoint, I would hope that chiropractic would be viewed as something that's supportive for what they do as well.
Right.
Okay. And then just like the relationship we've developed with our cross patients here is how can we benefit each other's patients for the betterment of them. Right.
Right.
And
Absolutely. Well, that collaboration is so important. We've harped on that a lot.
And that's also why I have the style of practice that I have is, again, what can I do in the gym for somebody to keep them out of my office?
Yep.
And I don't have the gym to create patients. It's
we
not
joke about that though.
Yeah. It's
He's
like
gonna kill you in
everybody
the
deadlifts
gym.
400 pounds with a hard, fast, jerky, twisty motion. And then we'll go ahead and schedule you for an appointment.
I mean, it's brilliant, really.
I don't want you in my office.
Of course.
Right. I want you to develop good exercise habits and techniques that are going to benefit you in the long run.
Right.
And really that's kind of my viewpoint on that.
Mm-hmm.
So
yeah.
Is it ever the goal to get patients that are in office into the gym?
Always. Okay. But that crowd is that crowd as far as like, I have people come to me because I'm a chiropractor, not because I own a gym, and referred from other people. And so their sole outcome goal is just to get better chiropractically.
Yeah.
Okay.
Right.
Am I out of
I heard
pain?
fix it on my go.
Yeah.
Right.
Yeah. And that's fine too. Again, not everybody's going to fit in every single way. Right. And so, I meet them where their needs are.
Sure. Absolutely.
Do you think that has something to do with like that you're kind of referring to two different types of patient bases, like almost two different cohorts. And you have the cohort that might be more like Callie and I, where we're looking to accomplish some goals over a long period of time. Is chiropractic looked at as okay? Closer. All right. So is chiropractic looked at as the chiropractic side more of like a maintenance? A maintenance
question.
thing, or are they looking for improvements, or how do you think
I have all of that.
Okay.
I do have some patients that come to me on a routine basis, job related things, stress, posture, things like that. So I see them weekly.
Oh, wow.
Okay. Very small amount percentage wise that I see like that. Then I have another group that I see 2, maybe 3 times a month. And then I have my others I see them maybe once or twice a quarter. And then others that I see when they're hurt.
Yeah.
I just recently had one that I literally was about to retire their folder, and they called me the week before.
Oh my
so
goodness!
I was like, "You're lucky.
Yeah,
you would have had to been a new patient."
It cost more.
Been a while. Yeah.
Oh,
so,
man.
and again, I meet them where their needs are. So, again, the patients that I'm seeing on a very frequent basis of a week or every 2 weeks, those are people that they're. I have one that's a martial artist that he's beating himself up all the time. Okay. Then I also have a couple others that are they're office workers. So their posture is at a desk all day long. They don't get up and move around much during the day. And so, they come in for, I do a lot of tissue work, trigger point work, stretching, things like that. I don't always adjust every single person. I tell my colleagues that I'm almost anti-chiropractic chiropractor sometimes. Like
that's
maybe
amazing.
you don't need an
that's
adjustment.
amazing though. And
maybe
I hope you guys heard
need
what
to
he
get
just
the
said.
mobility.
Right.
And that's more of a physical therapist type mindset.
Yeah.
But that's where their needs are. That's
Sure.
And so it's almost heretical to say as a chiropractor, but it
No,
is the
it's
truth.
so important.
It is the truth.
I've told patients before, like, he is not going to do something if it is not needed.
Right.
Which
Correct.
we have a specific endodontist for just side purposes that we refer to. She's wonderful. She is more holistically minded, which is like people would think would be an oxymoron because root canals have such a terrible name. But I explained to them, like, she's the first one that will not do the root canal, that she will tell you, this is not going to age well. This is not going to heal well. I'm not going to do it because you'll never know that there's a chronic infection afterwards. And so I've literally had to tell people that are afraid of chiropractic, because I didn't realize how many people were afraid of chiropractic. I've been going to chiropractic since I was 9 years old. Okay. Like, I'm not afraid of anybody, but I didn't realize how many people were until I was like, okay, your jaw. Okay. So you need to go see my chiropractor. And there's like, oh, I mean, this one person had a stroke after, and I'm like, actually, could you just comment on that just for this person?
Sure.
Because I'm like, people are saying that all the time. And I'm like, no, I promised you're not going to die. Like,
No. So statistically speaking, it is very, very unlikely that you're going to have a stroke. Does it happen? Absolutely.
yeah.
And from the medical perspective, not to bag on them, but patients die during surgery. Patients die in routine procedures, right?
Right.
But they don't blow that up, right?
Right.
But unfortunately,
Good
chiropractic
point.
for some reason just gets a really bad rap about that.
Sure.
And it's the statistics vary from 1 in a million to 1 in 10 million, depending on what literature you're reading.
Wow.
It's pretty broad. I do know that one of the studies showed that you're actually more likely to have a stroke from having your head tipped back in the bowl, having your hair washed at a salon.
Wow.
Because it's the same extension compression on the artery that feeds the backside of your brain. So, you know,
Nobody's going to go get their hair cut.
I'm not going to say don't go to your hair stylist and get your hair
No,
washed.
that is
You know,
great.
It happens.
Right,
and so,
right.
You know, people have car accidents and die, and we
Yeah.
don't tell people don't drive.
Right.
So,
That's a very
so it's
low
very, very
percentage.
rare, but it does happen.
But I also know that just with a family member of mine, like, you didn't adjust him because the blood pressure was so high. So
absolutely.
you are literally going to screen for that too before you just like, yeah, lay back. Let me just
Yeah.
Steven Seagal you.
You know, I had a patient you referred to me last week.
Yeah.
Okay. Came in. She's like, I don't really like that neck thing.
Oh,
Okay.
yes.
Well, that's great.
Good. I'm glad
Because
for
you're
that.
here for TMJ.
Yes.
And so let's work the TMJ. I'll do
thank
some
you.
soft tissue work. I got up into her suboccipital muscles and she's like, wow, okay, that hurts.
Oh, yeah.
But I'm not going to adjust it. We're going to do some
Right.
tissue work, try to strip these muscles out, get them to relax.
Fantastic.
Maybe that'll take the pressure off of that and help with yeah, she does do some clenching and grinding. I think that's
Yes.
what
Yeah.
she came in for.
Everybody I send you is
Yeah.
got sleep apnea,
Yeah.
clenches the hell out of their jaws, and I'm
Yeah.
like, help. That's amazing.
All right, so I'm going to share my first experience at a chiropractor. It's
Okay.
not you,
Disclaimer, it wasn't
all right,
Zach.
but I was doing something. I think I had an old Mustang, and I was changing a fuel pump on the side of the road because that's what you did with that old Mustang.
Yeah.
That was your preventative maintenance. Your fuel pump would go out, so you have 2 spares in the trunk the whole time. So I was doing it, and I remember being like on the road, on the side of the road somewhere. I went down to do something, get under the car. Man, and I hurt something. And I was like, golly. And I knew Callie and her dad. And I think maybe it was on the way to dinner with them when Callie and I were dating in high school. And he goes, oh, you got to go see this chiropractor. And I was like, I've never literally, maybe I've heard
He doesn't
the
come
word.
from a chiropractor
What is
family.
that?
Yeah. And so I show up and he is a very nice guy, but it was the typical, like, you know, like throw you on the table. I
Literally, the guy was
he had
so
me
burly.
on these what is it, the TENS unit for maybe 10 minutes, pretty much, like maybe a little bit longer. I couldn't feel it after a little while, and he came in to do it, and man, he had me in like a headlock. He had me in the arm bar. He had me in leg lock, and it would be like take a deep breath out and then crack. Oh my gosh. It was the freakiest thing. There was no warning.
And poor Kyle
I'm
goes
like
in, like,
18 years old.
no idea what's about
And
to
I
happen.
thought, I'm never freaking going back there in my entire life. Like, and they're like, oh, you've got a rib displaced and you've got some stress right there. I was like, yeah, okay,
Sure,
okay.
great.
Right.
But the next time it happened, like, I don't know, 2 years later, I was like, I'm not getting this fixed. This is my cause of death. It's going to be dislocated rib for me. So,
Oh my gosh.
see, I know there's a difference in not just like the dentist and how some dentists are gentle and some are not gentle. Like your hygienist will clean your teeth rough, and some of them are most of them are like ours, and they're They're gentle.
Very gentle.
And so, and I know that there are chiropractors are like that because you are definitely more of a gentle chiropractor.
Okay.
But how do you like I don't know, how does that translate? Like, is that like a bad thing to say? Like, if I say, go to Zach, he's a gentle chiropractor.
Yeah, is that like are we degrading you?
This is your viewpoint of me.
Yeah.
Because I would bet there's probably some other patients of mine that would disagree with what you're saying. And
I could send them to a guy, and they would see you as a gentle
I mean,
chiropractor.
some people I just need to be a little more aggressive with and
Sure.
to get things to move. It just is what it is. Yeah. So I guess I just haven't had to be that rough with you. So
Well, interestingly too, in the way that you stretch my neck, nobody had ever done before. My neck was a really big problem, guys, until I got my tongue tie fixed. I saw Zach fairly regularly for my neck. We got that done, and he did some really cool lasering as I was healing. I think I saw you like relatively quickly. I mean, I had stitches all underneath my tongue after that. But the way that you would stretch was just like so good. So again, just a plug for that. You don't always just get cracked and popped when you go.
Oh yeah.
The muscle stuff's really important as well.
Yeah. So do you have a 1,000-pound club guarantee? If you don't get to 1,000 pounds, then
You get your money back?
You get money back.
No way.
Well, if that's the case, then we're definitely getting you to 1,000 pounds.
He's like, I can't afford not to. You're going to hurt yourself.
Well, this is the second episode we started talking about this, and I started thinking about it because at first I was like, I don't know, I don't really want people to know.
Yeah, because now it's like out there.
Now I don't want it to be a big deal, and you know, all three people that listen to this podcast will
Right,
be holding me accountable next time I see them. But for me, it was I don't know, being goal oriented helps me get up and do something.
Mm-hmm.
And so I was getting to a place where I was constantly injured with my shoulder, and then I had my shoulder surgery, and then we got back to where I was, and then I think that was like maybe like 6 months after my surgery, and then I set the goal. I was like, I want to do 3 plates on deadlift, and I want to get to 2 in bench, which I'd never done before.
Mm-hmm.
I think I'd done 3 plates on deadlift once before, but definitely not 2 plates in bench. And then when I got there, and that felt really good to get there. And then I was thinking about, I was like, man, like,
What do I do next?
like it's really like, I'll keep showing up, but it's like really hard to get excited about going to the gym for me without having a goal.
Yeah.
And so, you know,
Tell Zach something he doesn't know
but I mean,
about us.
I'm just sharing a story. Okay.
I'm
All
just
right.
teasing
It's
you.
for the listeners, not
Yes.
for me.
So, golly, I forgot where I was going with that. Geez, thanks, Cal.
I'm so sorry.
What was I going to say? At any rate, I'm impressed. So I'm impressed with just where I've gone since Callie started feeding me properly.
Oh, here we go.
Because I know you were equally shocked to hear that my protein intake was about the same as that as a newborn baby.
Yes.
Okay.
Especially after we had the talk about you need more protein,
Well,
but
you didn't
I
have
didn't
it with
realize
me.
how little you were eating.
Yes. Well, it was like you gave me like your recommendation was that supplement you gave me, and then I think that has probably 6 times as much protein as I was getting.
Is that right?
Which got me to about 20% of what I should have been having anyway.
Guys, I feed him a lot more now, okay?
Yeah, no, I feel totally different since I started eating better, and the workouts seem easier. Like,
well then,
Uh-oh.
yeah.
when do I see you again?
It's real funny.
How much time do I have to rewrite your workouts for this week?
Well, I'll tell you, on bench, it's feeling really good.
Yeah.
But you know, I just like our programs. I mean, I think you know, having deload weeks and having what do we call them? The worst day ever, or no, the rep test days.
Rep test days. Yeah.
So,
Yeah.
anyways,
Well, with we can use you for an example. How I write your workouts, we already know what your goal is, right? And so the outcome is the timeline. I don't know how quickly we're going to get there, right? So I know that there's going to be, we have to push, but we also have to back off. Mm-hmm. And so I build those in. Rep tests are just one of those things to torture you.
Good to know.
Hey,
and embarrassing.
I did a rep test on deadlifts on Saturday, and I am sore today.
Yeah.
Very sore. One of my clients earlier dropped the bar on the floor as a bailout on her form just went bad, so she dropped the bar, and I was like, I don't want to pick that up. Man. I'm hurting.
Oh, no.
So yeah, I mean, I go through what you go through. So I suffer as well. I won't make you do something I won't do.
But I think, as you were saying, with like staying goal oriented, having something to look forward to is built in your DNA. And I would say mine too, maybe not as crazy. I'm like, hey, you want to go on vacation? He's like, oh, I have no time for vacation. You know, we have things
Did you
to
just
do.
give me a Russian accent?
I don't know, maybe.
That's not a little.
I don't know what it was. But I think that it just speaks to what you expect of yourself and how we carry ourselves, and working out like we do now, which was like missing for so many years in our life. I've noticed a big change in just our overall health, and yeah, we're super grateful for.
Yeah.
No, one of the things I most dislike when someone comes to me is telling me their goal is to lose weight. It's so vague, you know, and it's like, okay, let's have some other outcomes that we can shoot for here. What are the things that what are other things we can try to do that's ultimately going to get you to that goal without making it just, you know, what, 75% of the American population wants to lose weight or should lose weight, you know? So,
and it is interesting that you say that, because that's never something that comes up in our conversations. You're never asking me what I weigh or anything like that.
No.
And I've never really noticed it until like really this moment, which I don't get on the scale a lot. I don't. I will probably a few times a month just to make sure I don't need to dial something back in. Yeah, I just turned into a porker over here. I don't know. But that's really interesting, because I wonder if other trainers that are not as good as you are asking that a lot, and maybe the focus should be elsewhere. But
well, every single client, I have my set of goals as well as their set of goals.
Okay.
So I have, what is it I want to try to accomplish that is going to get them where they want to go, and that's going to benefit them.
Yeah.
Okay.
Right.
So to them, it may seem like if I just like I told you, one of my goals for you is 2 plates on deadlift.
Yeah. Now you've told me
is that really a goal that you wanted? But do you realize how close you are?
No, I had
you
no
know,
idea.
you're like 10 pounds away.
Oh my gosh,
so
that's great.
Maybe 15. I can't remember right off the top of my head, but it's very, very close.
Yeah.
And so I'm working you towards that without you really knowing that I'm working you towards that.
That's amazing. I love it. You just have to share the limited amount. You know how I.
But it's things like this too. What is the importance of a deadlift? Okay, and so I'm a chiropractor. And you wouldn't believe how many times I have people tell me, "Oh, my chiropractor told me deadlifts are terrible for you." Well, they're not. They're very good for you when you do them properly. If you're going to do heavy deadlifts with poor form, yeah, they're bad for you.
Yeah.
Okay. But overall, as an exercise, what is more like something you're going to really do? Are you going to bend over and pick something up? Right. That is a normal exercise, a normal functional movement for somebody to do.
I usually pick up 405 pounds.
Yeah.
When I go to grab Callie off the floor. No.
Wow.
Oh my God. Y'all, he's that might be your clip right there, Just kidding. Please
but
don't.
that deadlift, what does it mean? Again, I mentioned that earlier as far as your effect on bone health and your what is that going to do for you long term when you're 50 or 60 years old? What is that 225 pound deadlift going to do right now?
Yep.
And what is it going to do long term for you? Okay. And so
that's the longevity thing, though.
Yeah,
that's
the longevity
how are
thing.
you going to age, which is what we're harping on all the time.
Yes.
I will show people their teeth and their gum recession from their clenching and grinding and literally say to them, this does not age well.
Yeah.
I know what this looks like when you're 60. And I think if anything, the same can be used for physical fitness.
Absolutely.
You have to do this so that you age healthier.
It's the long-term effect. And we've talked about, I don't know if we can plug other people, but Peter Attia's book, Outlive. That dude, when I found that book,
amazing.
That was the book that's in my head that someone else wrote. Yeah. I was like, that is the key.
Right.
That is the key. My great-grandfather, he was forced to retire at 92 and it passed shortly after that.
Wow.
And it's like, okay, he had something to do and he was healthy. It was a physical labor job. He had something to do up until that time. And then when they took that away from him, it was like, okay, well, that's it.
Right.
And so I kind of look at that as not just my goal for myself, but for everybody that I'm working with is like, how can we have you age gracefully?
Yes.
I told you about John, my 87-year-old that I train. He had a stroke And when he was 85, it was shortly after he deadlifted that record, which had nothing to do with it. It was a completely separate incident. But the day his doctor cleared him, he came straight to the gym from the doctor's office and said, "I'm ready to go."
Oh my gosh. Wow.
And I was like, okay, well,
you're like, I'm scared.
this is a new one for me.
No kidding. Right.
But just last week, now I have to modify some things for him, but he just deadlifted 210 pounds last week.
Awesome.
Wow.
He has to use a walker to get around.
Right.
He has his deficits related to his stroke, but
he's still doing a deadlift.
Yeah.
200-pound deadlift. And he uses the walker.
Still motivated.
Incredible.
To come into the gym and just not give up.
Right.
And so like I said, he's kind of like the guy that I'm following. It's like, wow, this is what it looks like.
That's the mindset too.
Yeah, it's a mindset. And so back to your 225-pound deadlift, it's like, what is that going to do for you long term? Okay, one of the markers for overall mortality is grip strength. When someone's grip starts to go, that's an indicator that their health status is decreasing as well.
Wow.
Okay, and so I know that as long as you have a good deadlift, you have good grip strength. When you're doing pull-ups, okay, you're holding onto that bar. I know that that's going to carry over to much longer term things for your health and well-being.
Right.
Than it's just a pull-up or just a deadlift.
Wow.
Right. So,
and I remember early on when we started the pull-ups with the thick band, my hands would ache. And I remember the first couple times we did it, I literally woke up and I didn't even remember the pull-ups being like a part. It took me a while to realize, like, I wonder if my hands hurt this bad because I'm building my grip strength. Sure. And somebody in my circle was like, well, maybe you shouldn't do that. Like, maybe you're going to hurt your hands. Or it was always this mindset of like, if it hurts, you shouldn't do it. And I'm like, no, man, like Zach's got it. Like whatever, I just walk right off the bridge if he says to do it. And so I'm like, me building that strength doesn't hurt at all now, but I can't imagine like what my grip strength was when I started with you. Fast forward 3 years, what it is now. Yeah. So I found it fascinating.
I can testify to that because as dentists, I think we work with our hands all the time. We think we have strong hands. Yeah. And I think what we have is precise hands.
Absolutely.
I think that's something we have, but that doesn't mean strength. And so, because there's been workouts with you, especially early on, and when I was working 5 days a week as a dentist, and I would struggle to hold an instrument the next day.
Yeah.
Oh,
and I remember one time it got so bad that like I had to stop and take a minute because I was so fatigued so early on in procedure, I was having trouble holding the drill. And because if you ever go meet Zach and go to his gym and work out with him, you'll find out that every day is leg day. But for some reason,
so true. No.
on leg day, you will also get sore everywhere else. You will have sore shoulders. You will have sore forearms.
Oh my gosh.
And so, but that was like a moment for me because it's like, I always thought like, my training as a dentist and being a dentist, man, I had strong hands, a firm handshake, all those kind of things. Were like, that is nothing. Like that is a nothing sandwich compared to like holding. What is it like to hold on to like 315 pounds? That's a lot.
Yeah,
that's a lot. And that's that's not what I have to do in a pull up. Thank goodness. But that's.
Apparently, I'm pulling 405 pounds up every time I do a pull up. Based on your comment,
that's impressive. Actually, that's impressive.
Yes, that is actually.
You are so in trouble for that. You don't even know. Well, this has been awesome.
Well, I do want to close with one thing. I want to talk about workouts in people who work out in the morning, people who work out in the afternoon. It seems like there's a herd of people who get up and the first thing they do, before the sun is up, they're in the gym and they're sweaty and they've got big weights on, they're running their 4 miles. And then there's the people who are, they're not morning people. They're like me. And that's kind of more challenging for them, especially before work. And so they're hitting the gym after work. They're hitting the gym in the evening, that kind of thing.
Sure.
Can you talk a little bit about the differences and, does the body know the difference? Does the body care? Or are there different people who benefit from working out early and people who benefit like maybe by age too? Like, is it better for, 65 and up crowd to be in the gym early or not? I don't know what I'm asking.
So there's a couple things there. I think one of the things, I think it really honestly depends on someone's what is called chronobiology. Like some people are morning people, some people are night people, right? And Matthew Walker talks about that kind of stuff with people who sleep. I think there's a whole lot of truth to that. Some people just wake up and they're ready to go, and they go to the gym and work out. There are other people who, no matter how much coffee you pour into them, they're not going to do anything till noon, right? And so I think that finding where that person is on that is what will optimize that for sure. And so as far as do I know the answer to that, I don't. But I think that's what it has to do with. It's just their natural body type and when they're optimal. My personal training time is late afternoon because it fits my schedule best. But I've also found years ago I used to get up at 4 o'clock in the morning and work out every single morning. And then when I got into chiropractic school, that didn't work so well. And then about halfway through chiropractic school, when your schedule lightens up a little bit, I could start going to the gym, and I started working out around 2 or 3 o'clock in the afternoon. And I was like, wow, my numbers are way better than they were at my 4 o'clock slot there. And so, for my optimal performance, I still maintain that as far as my training. And, so I have my day up to a certain point, then I do my own personal training. And then I have a few, extra classes after that or clientele that I train and, call it a day. But I just know that's where I'm going to get the best workout. If I don't hit that window, I'm probably not going to do it.
Because I would say you're not anybody else. Person.
I'm not a morning person.
Yeah.
Mornings are hit or miss. Like, I feel like I don't hit my stride till like 2:30, 3 o'clock, like at work. Like when I'm doing like operational stuff or business stuff or whatever it is, I feel like as soon as it hits 2:30, 3 o'clock, boom, I am peak.
Kyle and I are very different in that regard. I'm very much a morning person. By 3 o'clock in the afternoon, I'm all done. Like, I would rather just be winding the exact opposite. So it's hard though, having kids and having to be up early and getting the day going. I will try to like handle breakfast and like the initial just everybody being up and calm when it's ready. Cause I just know that like, you know, physiologically he would really like to sleep longer and he can't. So
that'd be an interesting thing too. Your CGM. I don't know if we can mention that or not.
Yeah.
So, again, I'm constantly thinking about things like this.
Sure.
Why don't you track your blood pressure and your glucose levels in relationship to when you feel like your peak time is and how it responds to forcing yourself to get out of bed.
Yeah.
Like when he wakes up.
What does that do? Yeah.
Well, I usually get out of beer out of bed.
Wow.
Out of bed because of fear. Okay, so Callie has this fear program.
Oh, jeez. Here
for
we
me.
go.
And what I'm afraid of is cold breakfast. Okay. And so if I wait for her to say my name 4 times, then breakfast is
like your snooze alarm.
Yeah.
Right.
You know, but sometimes I've slept through the first 2 and I think I get up on time for warm breakfast and I didn't. I get so disappointed.
Kyle.
So, I think that's what my question was about, was just, you know, is there a good time? And because I personally think, because we work out 2 different times right now. We work out at noon and we work out at 8. And my noon workouts feel so much. I feel like clear-headed. I feel like I'm just more ready to go when I get there. Yeah. My 8 o'clocks are like, you know, I feel like I haven't got a chance to start my day. I feel like I'm
behind. That could be a mental thing though, but you're feeling behind for your day because you're not really kicking it off till 9:30.
Yeah, but it's also like I don't want to do this. I struggle with that way more on 8 o'clock than I do at noon. Yeah. Because at noon I'm like, yeah, let's go. Like,
yeah. Well, then maybe that's when your time should be.
Well, I mean, I can't work out in every one of Zach's lunches.
Oh yeah, true. Yes. He does have a life. Yeah.
Yeah. It is rude to
I just don't know how in here you ended up getting to go back to twice, maybe even 3 times last week, if we're being honest. And I'm still sitting on my Tuesday mornings.
Yeah. Life is full of choices, honey.
When you're ready to change, just let me know.
I know.
Let me know.
All right. So
of course, I would have to alter my workout plan through June with you.
All right, so we got just a few more minutes left, so we want to ask you the follow-up, the pass-along question, because we do a pass-along question from the previous guest to the next one. And so I'll prepare you right now. After you answer this one, we're going to ask you for a pass-along question for the next guest, who actually is going to be Jay's mom and dad. Oh, right?
You mean Callie's mom and dad?
Oh, yes, Callie's mom and dad, Jay and Tracy. Sorry, I don't...
See, but that's kind of loaded because I know Jay and Tracy, so
great.
Actually, it might not be my parents. It might. Yeah, it's not. Yeah, it's Jackson Appel.
Oh, yeah. Perfect. Okay. So the question that we have from Amy McDowell Williams is, what do you do to mitigate stress?
I work out.
Oh,
Workout.
I do.
nice.
I my workouts, where I'm at in my lifting goals are not the same as what they were 10 years ago. I used to compete in powerlifting, so it was all about how much weight can I lift, and I wouldn't miss a workout for nothing. Now it's, although strength is part of my goal, it is becoming more broad based in my overall wellness. Okay, I do a lot more cardio activity than I used to do. That's counter to when you're wanting to maximize weights, and so I've broadened my base. But one of the things too is, a lot of times I look at it as a kind of my own time, meditation and reflection and prayer. I do all that stuff. I mean, I've been in the middle of a workout and just found myself thinking about, what are someone else's needs, and praying, and just like, oh my gosh, I need to get back to this because now I'm cold, and
your muscles have to it.
yeah. It's just I've turned it into that for myself. It's more of a,
that's wonderful.
It was fun competing. Maybe I will again someday. Maybe I won't. I don't know.
Well, didn't you have somebody win like first place this weekend?
She did not win first. She won third.
Oh,
yes, third at the Arnold.
amazing.
So yeah. She
At the
she
Arnold?
did super. Yes.
Oh,
Wow.
nice.
Yeah. She took third. She actually tied for second, and then they had a tiebreaker event, and it was not one we had trained, so wasn't in her favor.
Sure.
So
Wow.
it was what it was. But our
impressive.
big goal was to get her to the second day. The top 4 lifters went from day 1 to day 2 to compete for the finals, and the primary goal was get to day 2 and do the best you can.
Yeah.
And I was, even if she would have got 4th, I would
So
have been proud of her. Yeah, she did great.
That's awesome.
That's awesome.
Yeah.
That's awesome.
Yeah.
Okay. So now I don't know who put in this question. We polled the audience. Okay. And someone wants to know, how old were you when you made it to the 1,000-pound club?
Oh, geez.
Don't say 17.
16?
Oh my gosh.
Oh my gosh.
Probably so. Yeah.
Wow.
Wow. Okay, great. So
I've always been a really
Kyle's
good deadlifter.
balloon
I'm 31
so
years
that
behind.
one carried my numbers quite a bit.
Okay.
We're gonna have to do some sort of video crazy follow up if you hit that this year, just in because
sure.
of this.
Yeah, the 3 people
podcast.
listening were really going to want to know.
Yeah. Well,
How
I don't
was
know.
my
We
form?
got 2.5 million on one clip, so
Yeah.
you might have more people.
Well, okay. So what is your pass along question for the next guest?
Whoever that may be.
Whoever it may be. There's so many questions I have in this world.
But if you could think about it, maybe in the context of we get to ask a question, but say, "Hey, sorry, it was this other guy. We can't help it."
What?
We didn't want to ask this, but we have to. It's tradition.
Right. Honestly, I love to read. What do you like to read?
Awesome.
Okay.
Yeah.
That's a great one.
I think that tells you a lot about a person.
Mm-hmm. Ooh. Well, thank you so much for coming on.
Absolutely.
Seriously, this was a lot of fun. And we look forward to more people hopefully hearing this and calling you like crazy. If you guys, again, are in the Houston, Clear Lake, League City area, you've got to look up the Warehouse Gym and McVey Chiropractic. You will probably speak with his beautiful wife, Sharon, when you call, and let him know that you heard him on the podcast.
What is the website?
For the Warehouse Gym?
The gym and
warehousegym.net.
Warehousegym.net.
Yeah.
And then for the practice?
McVeychiropractic.com.
McVey
So we got a
chiropractic.com.
.net and a .com. Yeah.
Okay. Y'all have any social media accounts?
Yeah, don't ask me that.
Yeah,
I'm not a
yeah,
social
he does.
media
He has an
person.
Instagram. We will tag it when we post this. It
Okay.
is Your Warehouse Gym, and I got you there. So,
Okay, thanks.
Yeah.
You've probably been to it more times than I have.
I have. All right.
All right. Well, that's it for this episode. Thanks for joining us. And we'll have our next guest, an episode coming up soon. If you have any questions about what we've talked about today or anything to do with Zach's gym or our practice at the Airway Dentist or New Teeth, just go ahead and send us a comment and just let us know. We'll be happy to get back to you.
Thank you very much.
Bye, guys.
That's it.